NEET MCH 2026. We have so many surgeons aspiring to be MCH after having done MS surgery, and there are so many branches into which a surgeon has got the options, and depending upon the surgeon's choice, there's a lot of competition for MCH examinations. The super specialty examinations like the NEET PG examinations are now online computer based examinations. And as far as the MCH examinations are concerned, there is not much of a matter related to the MCH examinations. And during the last few years, I have come up with a specific MCH book comprising of the super specialities. And the important fact about this book is that it caters to the most of the MCH aspirants. And I have taken into consideration the valuable suggestions from the people who have qualified MCH in various specialities and then come out with this project which happens to benefit a lot many MCS students in their preparation. Now having a positive feedback from the students, and we see that the fact is that the MCS super specialty comprises of questions from general surgery. General surgery is asked in all the branches, and you have to know what are the PYQs, the previous year's questions, what is expected ahead, what are the latest development as far as the super specialties are concerned, what is in the examiner's mind. And with so many super specialties there, you have to have a good knowledge. In addition to that, surgeons, they do not have that much time as like other people because they spend a lot of time in the theaters and they do not have a compact series of matter available, any content available, which helps them in the study of their specialities. Now, as far as the general surgery super specialty is concerned, herein we have got what I've combined. I've combined the general surgery, I'm to say all the surgical anatomical aspects which are very important, and the many questions are asked from basic surgical anatomy of the relevant specialities. And then we have got very important subjects like the urology, like the head and neck surgery, like the plastic surgery, like the neurosurgery, like the vascular surgery, like the thoracic surgery, like the musculoskeletal surgery, and to enumerate a few. But this book is compact. It has got almost all the super specialities embedded in it with the questions and the quality, I mean to say, of the standard of super specialty examination. This examination is quite different from NEET PG examination and it is at a higher level, so the standard of the questions is also higher. Now, what's important in this book is that I have combined the previous year's questions, the new questions, the expected, the most high yield topics. Important for a surgeon to remember is that there is a set of subset of questions which are always asked, and once going through, I mean to say, the question bank of the previous year's questions asked, I could say so many questions on the same topics. I mean, say multiple endocrine neoplasias, a huge chunk of questions asked from men's syndromes, a huge chunk of questions asked from oncology, surgical oncology, the oncological perspectives from a neurosurgical viewpoint, say glioblastoma multiforme, say medulloblastoma, say meningiomas, say the Mets, say so many questions on RCC, so many questions on adenocarcinoma pancreas, so many questions on, I mean, say GI malignancy, so many questions on Zollinger-Ellison syndrome, so many questions on gastronomas, somatostatinomas, the VIPomas. And my point is that we get a good chunk of questions from the previous year's questions or the related topics. That is what I have focused in this thing. Maybe some of the questions are level A, level B, level C, according to the severity, the difficulty, the moderate, the mild, and the severely difficult questions. So it is all there. Even the basic, very simple questions have been asked. And that is what I have put up in this book. So you can see that there is the thoracic surgery, the vascular surgery, the gastro surgery, all the things are covered there, chapter wise, topic wise. So you plan the study, there is not much for the surgeons to plan in view of the time I mean to say they don't have the luxury of the time at their end. So I cannot just focus much on the planning. So as far as the effective surgical techniques are concerned, the study techniques are concerned, you can see pediatric surgery, gynecological oncology, plastic surgery. I have combined all the, I mean to say, in a very systematic and a flow-wise manner, so that you read a topic one first, then the second topic in a very graded manner. So all the topics are well segregated. You can see, as I mentioned, and then it's not only it is head and neck surgery, neurosurgery, endocrine surgery, which are already there. So important fact is that the manner in which you have to study with all the things into concentration. This cannot be a huge book of 1200, 1500 pages. So it has to be concise, giving you the exact idea of what to prepare in view of the limitation of the time surgeons have. I have been a student of surgery myself. After having done MS anatomy, I was doing graduation in surgery, MS surgery, for some quite some period of time, and I could see the time schedules which we have. So only issue is that we do not have that time. So that is why I just did not get this book of a bigger volume. I got it of a concise volume, and I will be just adding some of the matter in a small booklet or next edition in ahead as well. But thing is that it should benefit the students to the max. Thoracic surgery, surgical gastro, vascular surgery. You can see it is all given there. The question, the standard of the question, the level of the questions, what's in the examiner's mind, one step ahead of the examiners. That's exactly what a student needs to know. So these are some of the things which I have incorporated in the book. But I would also suggest one thing: things do not happen in vacuum. Even despite being as MS surgeons, having a hectic time schedule, we have to have a bit of a time for studying for the MCS specialties. So, whatsoever you wish, some people want to have their, I mean to say, specialization in plastic surgery. Some people want to have their in pediatric surgery. That's welcome, but anyway, you have to put up a bit of an effort. And I think that this effort of mine, a small effort from my end, would benefit you as well. So I wish you best of luck and aspire that most of you just go through and have this tag MCH at the end of MS and after MBBS. Thanks a lot.